Hi guys, so I just watched a video by a group called the 60 Plus Association, which claims to be a nonpartisan organization speaking out for seniors' rights, and it was called "Don't Pay for Healthcare on the Backs of Our Nation's Seniors." And it was a very moving video. It was a video that shows the greatest generation and the struggles they've been through, the Depression, the war, the Second World War. All the things that they've been through, and then it says at the end, and now with this healthcare reform, we're planning on cutting all of their healthcare. We're planning on cutting into their Medicare. We're planning on taking away money from them to pay for the healthcare of everyone else. Guys, this isn't true at all. So some of the claims that were made is that for one, that Obama is going to cut $500 billion from Medicare in order to help pay for other health care reform. This isn't exactly true. The $500 billion cut to Medicare is actually going to be a cut from insurance companies. It's going to be a way of reducing costs, streamlining costs, rooting out fraud and abuse of the system by insurance companies, and instead focusing on making sure that every single penny that's going to Medicare is actually going to treatment. There are no plan changes to Medicare's coverage, so that $500 billion cut will not affect your coverage. It just means that you're going to be getting more bang for your tax dollars. It's kind of like buying wholesale instead of retail. You're getting a cheaper price. You're cutting out some of the money that would normally add on from the middleman, and instead you get to keep that money. And in this case, the savings will go towards reforming healthcare so that everybody else gets healthcare that is as good as what seniors receive. So some of the things that actually they're planning on doing with Medicare include reducing out-of-pocket payments and reducing premiums. So that means actually you guys will hopefully, if all goes well, you guys will actually be paying less for the same services, and I think we can all appreciate that. I know I like that. Another thing the video claims is that you're going to have to go to your doctor, and your doctor is going to make the decision, or rather, you're going to go to your doctor, and through a government bureaucrat, the government bureaucrat is going to tell you whether or not you deserve to live or die. This is another blatant falsehood. This has to do with the end-of-life planning. This is something I've talked a lot about. End-of-life planning is just normal things that happen as you get older. I'm 25. I have a living will. I'm not even very old, but I've already spoken with my family. I've written up a will that explains, should I become incapable of speaking for myself, if I become very ill, if I become very, very injured, these are the things that I would like to happen in order to maintain my dignity, in order to preserve my life in the way I think it should be preserved. And everybody has that option. Under Medicare already, every 5 years, seniors have a free visit to the doctor where they can discuss this with their doctor. And that doesn't mean that your doctor gets to talk you into dying. Instead, you get to tell your doctor exactly what you want to happen. You can say, I want to be resuscitated. I do not want to be resuscitated. If I need hospice care, this is a hospice I would like to go to. This helps direct your doctor's treatment of you, so that if you do become very ill and you are no longer capable of speaking for yourself, your doctor already knows what to do. And regardless, this meeting, this consultation isn't mandatory, and it's just between you and your doctor. Nobody can tell you whether or not you are value or not. The only person who can place a value on your life is you. And if you place very high value on it and you want to keep it, guess what? Your doctor has to respect that, and so will Washington. The next thing has to do with the people who made the video. They're called 60 Plus Association, and they claim to be a nonpartisan group that speaks out on behalf of seniors. This isn't true. SourceWatch did some research and found out that all of the funding for 60 Plus Association comes from the pharmaceutical industry. None of it comes from dues paying senior citizens, and none of it comes from donations from private senior citizens, not in the pharmaceutical industry. It all comes from the pharmaceutical industry. And they are claiming that they are a front group for seniors, while actually they are a front group for pharmaceutical companies, and trying to speak for you when really they're trying to frighten you away from listening to the truth and being able to speak for yourselves. And maybe you guys aren't comfortable with this, but it would be like me finding out that I was watching a video of people who claim to be representing young people, 20 somethings, and then I find out that actually they're people trying to put crack in my water. I mean, that's not very comfortable for me, and I'm assuming it's probably not very comfortable to you that you're being lied to by this organization, not only in terms of the content of the ads they're placing, but also in terms of who they claim to be. They are not who they say they are. They are the pharmaceutical industry pretending to be senior citizens to try to manipulate you and exploit you. And you should say no and stop listening to this crap. I hope you have a good day. Bye.